Let's talk about something nobody wants to admit they have: toe jam. I know it's embarrassing, but here's the thing. If you're watching this video, you're probably dealing with it right now, or you're worried that it build up between your toes that just won't go away. My name is Dr. Andrew Schneider, and I'm a podiatrist here in Houston, Texas. And in my 25 years of practice, I've seen thousands of patients who think toe jam is just a hygiene problem they need to be ashamed of. But here's what most people don't realize. Sometimes toe jam is completely harmless, and sometimes it's your foot's way of warning you about a much bigger problem. In the next few minutes, I'm going to tell you exactly what toe jam really is, when you should be concerned about it, and most importantly, how to get rid of it for good. But before we begin, if this information helps you, please hit that like button, subscribe to the channel, and share this video. It helps other people find the answers they're looking for. So let's start with the basics. What is toe jam really? The simple explanation is this. Toe jam is a buildup of dead skin cells, sweat, lint from your socks, and general debris that gets trapped between your toes. Now, why does it form specifically between your toes? Think about it. Your toes create the perfect storm. You have a warm, dark, moist environment with limited airflow. It's like a petri dish for collecting all this material. And here's something important. This happens to everyone. Even people with excellent hygiene get toe jam. So if you're dealing with this, don't beat yourself up about it. But let me clear up some misconceptions right away, because there's a lot of misinformation out there. First myth, toe jam is always a hygiene issue. That's simply not true. I've seen patients who shower twice a day and still struggle with toe jam. Second myth, toe jam is always fungus. This is a big one. People assume that any buildup between their toes must be athlete's foot, but that's not the case. There's an important distinction between debris buildup and an actual fungal infection. Understanding this difference is crucial because the treatment is completely different. So what actually causes toe jam? Let me walk you through the most common culprits. The number one cause is excessive sweating, what we call hyperhidrosis. Your feet have more sweat glands per square inch than almost anywhere on your body. If you're an athlete, or you work on your feet all day, or you're just naturally sweat more, you're going to see more toe jam. The second major cause is poor airflow from your footwear. Tight shoes, non-breathable materials like synthetic leather or rubber, these trap moisture and create that perfect environment for buildup. Third, certain skin conditions make you more prone to toe jam. If you have naturally dry, flaky skin, those dead skin cells have to go somewhere. And if you already have athlete's foot, that creates even more dead skin material. And here's something people don't think about: your socks. Cotton socks, especially old ones that are starting to break down, shed fibers that contribute to toe jam. The material of your sock matters more than you might think. Now here's the critical part. When is toe jam actually a warning sign of something more serious? If you're experiencing itching, redness, peeling, or cracking between your toes, that could be athlete's foot. If the skin between your toes looks white and soggy, that's another red flag. Signs of bacterial infection include a strong odor, soft wet skin, what we call macerated skin, or any pain and drainage. And if you're diabetic, this becomes even more important. Diabetics have an increased risk of skin breakdown and infection. Any persistent moisture or skin changes between your toes needs to be evaluated immediately. The key is this: simple toe jam shouldn't hurt, shouldn't itch, shouldn't have a strong odor. If you're experiencing any of those symptoms, it's time to get it checked out. All right, so how do you treat toe jam at home? The foundation is your daily cleaning routine. But here's the thing, most people aren't doing it right. You can't just let soapy water run over your feet. You need to actively wash between each toe, not just over them. Use your fingers, get in there, and actually clean between each toe. Then, and this is crucial, you need to dry thoroughly. I'm talking about towel drying and then air drying. Here's a pro tip. Use a hair dryer on the cool setting to make sure you get all the moisture out from between your toes. Trapped moisture is your enemy. For moisture control, Antifungal powders or sprays can be helpful. And if you're someone who sweats heavily, consider changing your socks midday. But sometimes you need to treat the underlying cause, not just the symptom. If it's fungal, and remember, not all toe jam is fungal, over-the-counter antifungal creams can be effective. But if you've been using them for 2 weeks without improvement, it's time to see a podiatrist for prescription and treatment. If excessive sweating is your problem, you can actually use antiperspirant on your feet. Apply it at night before bed and make sure you're rotating your shoes to give them time to dry out completely. For skin breakdown issues, barrier creams can help. But here's what you should never do. Don't put lotion between your toes. I know that sounds counterintuitive, but lotion can actually make the problem worse by creating more moisture. Speaking of what not to do, let me give you some important warnings. Don't ignore persistent toe jam. Chronic moisture between your toes creates the perfect environment for infections to develop. Don't assume that odor automatically means poor hygiene. Often, it's microbial overgrowth, which is a medical issue, not a cleanliness one. And please, don't over-moisturize between your toes. I see this mistake all the time. People think that lotion equals healthier skin, but between your toes, moisture is the problem, not the solution. Now let's talk about prevention, because preventing toe jam is much easier than treating it. Your foot hygiene habits need to include 3 things: wash daily, dry thoroughly, and inspect between your toes regularly. Make this part of your routine. For sock choices, invest in moisture-wicking materials. Avoid cotton if you're prone to toe jam, and replace socks that are old and shedding fibers. Your shoe strategy should include rotating shoes so they have time to dry, choosing breathable materials when possible, and if you're a heavy sweater, consider using shoe dryers. These might seem like small changes, but they make a huge difference in preventing toe jam from coming back. So when should you stop trying to handle this at home and come see a professional? Here are the red flags: persistent cracking or pain between your toes, any drainage or bleeding, spreading redness, or if you're diabetic and notice any skin changes. In my office, we can determine whether you're dealing with a fungal infection, a bacterial infection, or simply buildup. We can check your circulation and sensation, and especially if you're diabetic. The earlier you address these issues, the easier they are to treat. Don't wait until a simple problem becomes a complicated one. Here's what I want you to remember. Toe jam is common. It's usually not serious, but it's not always harmless either. The key is addressing it early with proper hygiene, the right footwear choices, and knowing when to seek professional help. Simple fixes prevent bigger problems, and healthy feet start with small daily habits. Thanks for taking the time to watch this video. If you found it helpful, please hit the like button and leave a comment. Don't forget to subscribe so you won't miss our weekly videos. If you're dealing with persistent toe issues, especially if you have diabetes or nerve problems, don't wait. Schedule a foot evaluation, and the link to schedule an appointment is in the description below. We'll figure out exactly what's going on and get you the right treatment. Thanks so much for watching, and have a great day.